So we're here to take a moment to do something we've been doing as we go along, essentially taking the concepts that we've spoken about previously and showing them as we are actually applying something. Now I know that I've looked at the hip in lateral recumbent and working through there. The video that I did on treating the hip, generally speaking, has this in it from a different angle. Now this angle that I'm going to work from isn't perfect for showing you everything that we want to show you. However, it will allow me to demonstrate some of the concepts without being in the way, right? So what we talked about before was using a yoke hold around the greater trochanter in order to be able to work through the soft tissues, or at least because we have all of that contact. So the idea of broad contact for multi-point discrimination, for palpation, get as much as you can touch, move from the known to the unknown, all of those things. So this is a good starting hold to identify the tissues that you may be interested in around the trochanter to be able to identify, from a diagnostic perspective, where the high tone area is, or where the area that feels different than everything else. So macro identifies micro. In sort of a unique sense, that broad contact for multi-point discrimination, as far as soft tissue is concerned, is when you're moving something around that is the macro sensor to identify the micro area or the smaller area. So we've talked about the hold before, and also the fact that the patient is in lateral. Less table means I need to make the patient more stable. So I'm going to use decent body contact. I'm going to make sure that the patient isn't too far away from me, that I'm not reaching, right? My hold, in order to get this, I kind of need to walk away so that the patient, so I may not have contact with the patient when I do this, but that's why when they're on their side, we have them in and around 90 degrees at the hip and the knee, because that helps them stay stable. So I take my hold, right? Contact is control and control is safety, kind of wrapping and reinforcing holds, right? I come up into the trochanter, right? So if you are not able to immediately identify the trochanter, that's fine. So also, just before I move on, sliding up, so I have some control in and around my patient. So I make some contact, obviously because we're in and around the pelvic region, we want to be careful and we want to be respectful, because for some people it is a sensitive area. So we want to be careful how we approach body contact here. Some people it will be fine with, some people it will be not so fine with, so you want to be careful. But we've got this large contact area to identify, and also, as I was saying, if you can't immediately identify the trochanter, that's fine. Broad hand, remove the trochanter, makes itself apparent. So I'm in here and trying to identify, just through motion, which tissues I'm going to be more interested in. Now what I want to be able to show you here is that based on area, so working perpendicular to soft tissue direction, kind of getting into some of the attachments as glute minimus and medius come towards the femur, rectus femoris, right? So there is a fiber direction that's going to more or less go this way. I can do a push-pull on that tissue there, right? So in this case, I need to move this tissue back more than I need to move it forwards. So I can do something like this, right? So I can kind of come back in perpendicular to that fiber direction, and I can work through it to some degree. Now sometimes it's going to work as far as this type of hand contact is concerned, so using my forearm, because it fits reasonably well here. I'm doing a pull towards me, and then using the lever, so I've got a long lever, a short lever, I've got mixed leverage here. Sometimes, not necessarily the tip of my elbow, but I can come in here and use more or less a portion of my humerus, again, like not the tip of my elbow, because that can be very difficult for some people to deal with, but I can pull back, kind of pin into me, and now I can do some work here, right? Now, in the case of this particular individual, as I have my hand in that yoke, there is some stuff further around the trochanter that I'm interested in, so a little bit more closer to hip rotators. So what I can do now is go from that yoke hold, come around. Now you'll see my hand facing this way because I want to go, again, perpendicular to fiber direction. Right? I just moved a little harder than I needed to, made the patient jump a little bit. But we can move perpendicular to fiber direction, and we can work on that here. So just taking this moment to show you all of these things. So patient positioning, contact is control, wrapping and reinforcing holds, working perpendicular to fiber direction, all of this stuff comes into play in something as more or less common as working on a hip in lateral recumbent. But again, we get that opportunity to show all of these things, to try to piece them apart. And sometimes delivery may be a little bit fast in the moment, but luckily it's a video, so pause and rewind.